from what I understand, one of your suggestions is policy owner, part owner. The idea of the patient, I guess, having more of an ownership stake in their healthcare. Help me explain what kind of a model you think would work.
Sure. So currently, the CEO of a publicly traded health insurance company is incentivized to go to all of the employers in the state and extract the maximum possible price he can from them for the purpose of providing health care. And then they're incentivized to provide as little health care as possible, ideally no health care if they could, and that would maximize their shareholder profits, maximize their bonuses at the end of the year. But you can see how that's not at all aligned with the interests of the patients in our state, that the company carves as much money out of our state as they can and then provides as little care as possible. In a mutual insurance company, the patients are the owners of the company. So the CEO of an insurance company like that is incentivized to negotiate hard with people like me, doctors, and the hospitals, but has no incentive to deny care, because to the extent that they deny needed care, the people who they represent will fire them. And so you remove this entire administrative burden that's been imposed on our country and really provides no valuable service except for enriching themselves. And that turns out to be 10% of America's gross domestic product. So if we can remove that, at least a big portion of it, we can save, I think, a third of healthcare expenditures in the country. Last year, in 2024, we spent $2 trillion on healthcare, the government did. If we were able to reduce that, we'd be able to save, $660 billion? That's a tremendous amount of money. It's enough to, if you were able to do that year after year, it's enough to secure Social Security in perpetuity. It's enough to reduce taxes, to start to reduce the deficit. You could return the money back to the states and provide, $13.5 billion per state. Governor Lombardo could do an awful lot with that.
It's a challenge to find nurses, to find enough qualified doctors. You are a doctor, obviously, already in Southern Nevada. What can be done if you're elected to Congress to provide the resources, the training, to improve the healthcare system and the care that's delivered in Southern Nevada?
So when I was president of the Board of Medical Examiners, I joined that body believing the storyline that you hear, that the quality of the physicians in our state is subpar in comparison to the rest of the country. I thought I'd ride in like a sheriff on a big white horse and clean this town up. And what I found out is the vast majority of physicians in our state really do an excellent job. And we make it harder to get a license in Nevada than almost anywhere else in the country. We require more continuing medical education here than almost anywhere else in the country. By dint of those two things alone, we should be slightly better than average in comparison to the rest of the country. And Nevada does attract people from all the best parts of the country, from all the best schools. They do come here, and it's their goal to try to continue to provide the excellent care here that they were providing just 2 weeks ago or a month ago at the world's best institutions. So what is it that stops them from performing that kind of care here? And it's the institutions within which they have to operate. There's a lot of regulatory reform that's going to be required here in order to start to solve the kinds of problems that vested interests have been able to capture in the legislation and through excellent lobbying that prevent us from being able to provide the care that we'd like to our patients.
The first thing is tariffs. They're there, they're not, they're big, they're small, it's a kind of a moving target to try and keep up with. We've talked a lot about the effects here in Southern Nevada on tourism. If you were elected to Congress, if you're in Congress right now, how would you address the policy, the economic policy, the tariff policy of the Trump administration?
So to date, it appears that from our Finance Department, we have can show that we have a $12.5 billion increase in the balance of trade due to the tariffs that have been put in place. That's an increase in the number of jobs, it's an increase in the amount of money coming into our country. If you look at the reports from the Congressional Budget Office, they indicate that over the next 10 years, we should have an increase in about $2 trillion available in our economy because of the tariffs that Trump is putting in place. So it looks like he's able to increase the amount of revenue coming into our country and increasing jobs at the same time.